I will show you in a real quick our document intelligence healthcare verticals. Two important workflow. One is the different medical records that it comes and what we can extract from the for those medical records, and also the prior authorizations workflow. Now, here I have one patient and I already uploaded a lot of documents, vectorized, chunked and vectorized. As you know, this is our self-service ingestion process, which I explained in the earlier one of the video. Here, what I would like to show you that how what does that mean, right? So I wanted to open up few of the source documents. So this is one of the policy documents for the prior authorization list from Blue Cross Blue Shields, right? So the payers information dimensions, that's which procedure code or diagnosis codes, right, applied to what kind of policies programs, right? So it means that's based on that, you know, whether if patient has a certain conditions, right, whether that is allowed for the prior authorizations or not, right? Now, the oftentimes the question comes, what is prior authorization? Before billing, right? This prior authorizations oftentimes is needed. Now, the question can come, that's why is this needed, right? I mean, this is how the payer providers and the healthcare, a lot of things is being set up already. That's provider needs to verify, right, before prescribing something or before putting some medications and all of these things, whether it is under the insurance coverage or not with the insurance companies, right? So that's what the prior authorization. So I'm going to explain that one. And I just showed you this one. There are a few other you see for the ECG also, right? There are some clinical guideline for the generic drugs, what it can use. So usually what happens is that for any patients, their insurance providers have these informations in place. So the patient knows if the patient wanted to take a look, but providers can always contact with the payer, right, or the insurance companies to check that's what are the coverage for a certain for a patient's uh, insurance, right? So now there is another I wanted to show the authorization requirements, right? You see that this is typically how it comes, and the different pairs has a different kinds of documents, right? Important piece is that these informations need to be uploaded to the systems and need to be vectorized to the systems, because prior authorization workflow works on top of it, right? Now, these are I showed you related to the pair related information, that pairs policy related informations. Now, I also uploaded the patients when patient visited to the hospitals and the doctors, right? There's some of the history here, right? So which I take from the my chart, right? So for example, the patient visited in February 7th, right? So and then this is the what the education summary that it comes from the doctor's office, right? So that, so for example, similar to that, there is a patient education's office visit, right? Just wanted to show you one of the office visit also. This is how it comes. This is work in health, and there is a providers related information. What are the medication that is being given, right? So medication, lab report, office visit summaries, nursing notes, when it goes to the hospitals, then the provider notes. So for example, I wanted to show you this one, right? So these are the daily progress, not on a certain day, when but that's what provider basically filled it up for the patients, right? So those are the provider notes, right? Then the care team notes, right? Physicals, and there are a lot of discharge summaries also there. You see that the discharge summaries, that's is the hospital discharge summaries, what it comes is, this comes as a comprehensive stuff, right? Mhm. Now, why did I do that? because our healthcare verticals basically can take all these informations and you can ask a lot of questions, right? So that's before your next visit to the doctors, right? So patient can basically did their own investigation, or the caregiver, right? The patient's family members or somebody who is little worried about the patient, they can do some kinds of analysis and also find out that's what to ask to the doctors about the patient conditions and all of these things. This is very helpful. Prior authorizations are basically provider side and the payer side, right? Patient also gets informed that what are the things that has to happen as a part of the medications, but it is more on the provider side how the prior authorization helps, right? Now if you see all of these documents for a particular patients, now I wanted to show you how our two important vertical healthcare workflow works. I'm taking one of the provider notes for this one. You know that right now we have a three important workflow. One is the clinical scribe, which I already showed you in another demo how it works. Patient doctor conversation that can be captured, right? And a lot of questions answers or the workflow has a specific fields that it's picked up to understand better whatever the conversation happens between the patient and the doctor. Put the patient and the doctors can have the benefits out of it. Patient can get to know whatever the whenever the prescription prescribed, right? What are the things are there. Same as that provider also about the administrative office of the provider, they do not need to look at a lot of manual stuff. They can look at these summarized information and get out of it. He explained in the completely separately in another video. Now here I will explain two things. One is the clinical workflow, another is the prior authorization workflow. Looks like this does not have a prior authorization workflow. Let me take this one. I think this does have a prior authorization of. I ran this before. Now let's look at what this clinical workflow says about the notes provider, right? Provider put in notes on February 7th, right? And there, when we run this clinical workflow, these are the steps that is being performed. What it is: healthcare document intake agents, clinical summary agents, lab results agents, medication review agents, care gap and follow-up agents, risk and safety flag agents, and PHI and governance agents. These are the different agents. As a multi-agent orchestrator, it works. It means it has a workflow setup. When it runs, what happens is it creates a summary, right, from these particular nodes. These particular workflow you can run in any of the medical documents. All the documents you can run. The advantage of running each and everything is that you can get some structured information out of it. Why am I saying structured? Whenever there is a note or anything comes, it can come in any formats, right? Here it gives the particular context, like a summary is coming as I know the flat text, right? That's a patient 71-year-old female presented a follow-up visit 10 days after hospital discharge for something, right? And what are the medication? That's what it says, right? Now the patient encounter context, patient date of birth encounter date, providers, facility encounter. Like this is the way the information, the structured information gets picked up from the unstructured documents, notes. Then it makes its own clinical summary, right? It's a nice tabular format it's putting. That's what are the assessment done in the clinical summaries: the confusion, sleepiness, hepatic encephalopathy, complexity of medical decision making of the patient, transitional care in moderate, right? Then the plan is, say, plan also, that's what are the care plan that is being done, medication reconciliation performed, current medications and discharge medication list reviewed and reconciled, no follow-ups on the file. So it means, see, that's the way it is done. Then the patient instructions, what the caregiver, sorry, what the doctor will basically give the patient instructions, right? Those are also being put it over there, right? Then the lab results, if there is a lab results, it does not Then what are the medications? That medications, whatever being put in the documents, it captured from there, right? Then the review flags. What are the review that has to be? It's a recommended review by the providers. Clinician pharmacist review is needed to address the patient's non-adherence to refluxamine due to lack of insurance coverage and high cost. Alternative options, patient assistance programs, or therapeutic changes may need to be considered. Look, these are very nice formatted way. All of these things comes as a part of a packet, right? Agent workflow packet. Then what are the follow-ups that has to be done? What are the care gaps? These also recommends, right? Patient is not taking a medication due to the lack of insurance coverage. Recommendation, you review medication access and affordability for that medicine, right? And explore alternative solution. No follow-up appointments on file after recent hospital discharge for hepatic encephalopathy and moderate complexity of transitional care, right? What is the recommended review for that? Review and schedule appropriate follow-up care given by the patient recent discharge or of hepatic encephalopathy. See, it's a nice care gap. Wherever the care gap, from all those discussions, it's able to extract. Then risk and safety flag. What are the different type of risk, right? So all of these things also it, and what are the recommendation. Then what are the governance related information? Some of the information that comes that can be redacted. Those are the suggestions also is being given here, right? So very big list, right? So now you see a comprehensive, this is not the information that the way it comes in the documents, but it puts a structured informations, whatever the real information that is needed for any of the medical records, right? That it's able to find it out from the different type of lab results, medication list, after visit summaries, educations, and many different type of documents. That's what the provider basically gave to the patients, right? Or the provider office administrative people basically gave to the patients. All of these things can be nicely captured, structured as a part of this clinical workflow. Now, the second workflow I'm going to say is the prior authorizations. Let's take a look at that. It's already been ran. That's why I'm showing so that I can save some time here. So, as a part of this, the healthcare document intake agents, prior authorization request agent, payer policy criteria agents, evidence mapping. Look, prior authorization request agent means that it is sending a prior authorization request for a for certain conditions, medications or something, right? Same as that it has to check the payer policy criteria against that. That is the second agents. That's a part of the workflow. Then the third agents are comes in place that's with the evidence mapping, right? Okay, is there any evidence patient has this kind of conditions? Right? Okay, these are the policy criteria has been listed, so I can map these particular conditions maps with this payer policy, right? Then the gap detection agents, right? Gap detection agents and prior authorization packet. Ultimately, it comes as a prior authorization packet, right? All of these things. It ensemble everything, and then it gives you the final output for that, right? If you see the evaluation results is it ensure that the agent completions, patient context, citation coverage, confidence, safety review, follow-up coverage, PHI governance, approval readiness, right? These are some of the evaluations because it's AI response. So AI response may give a probabilistic answers to how confidence we are in terms of the percentage that it gives with the explanations. Now, if you take a look at the summary of the prior authorization, as it says, the prior authorization is requested for a certain medication for a patient recently hospitalized for hepatic encephalopathy. The patient is not currently taking that medication due to cost and lack of insurance coverage. Specific policy criteria for hepatic encephalopathy are currently unavailable, preventing a full assessment of medical necessity and required documentation. See, the way it happens is the pair documents that it has, it does not very clearly mentions whether this rifaximin, right, is covered for the patient's insurance or not, or the information that is being so far extracted and given does not have the sufficient information not. So it is very important the pair or the insurance related information is fed into the system so that it can do a proper analysis, right? Typically in a provider settings, they know what are the because they always have a contact with the payer, they can easily do that. If the patient handles all of these things, and if the patient subscribes to these systems, then the patients need to talk to the payers and have to make sure they basically upload and feed into the systems. Now, patient context is same as the before. Now, what it comes with the prior authorization packet, it tells about the conditions, right? If you see the patient was admitted for something 10 days prior to follow up, presenting a confusion and sleepiness, it tells about your conditions, right? Then it tells about what it does, what does not, right? And then it says the patient is currently not taking rifaximin due to the lack of insurance cover, the high cost of medications. The provided policy document indicate that prior authorization required for administrative pharmacy are 845 services, but specific criteria for rifaximin for the diagnosis of hepatic encephalopathy are not detailed within the available policy informations. Therefore, a complete medical necessity narrative against pair-specific criteria cannot be fully constructed at this time. Right. So see, there's the prior authorization. How does this works, right? And with the mapping and everything. But then it says that the policy documents use pair criteria incomplete, right? It gives you basically it's incomplete. Criteria, if it's a complete, it's going to say you complete and tell you all the evidence and why this prior authorization, what is the result of those prior authorizations, right? It's a criteria evidence map incomplete, needs clarification, right? So it says that, right? Missing items, specific policy criteria for rifaximin for hepatic encephalopathy. This is the missing item. Reason: essential to determine medical necessity and required documentation for prior authorizations, as the provided policy is incomplete and lacks details of the medication and diagnosis. Ideally, even all of these details should come from the provider documentation also, so that it can be easily mapped with the pair policies. Oftentimes it does not come, and when it does not come, it is important to get the informations from the pairs policy so that it can be mapped properly so the authorization can happen. So if this happens, patient doesn't have to worry about too much about the cost and everything, because by the time patient knows that's how much cost that it can take for that particular medications. So if there are other alternates, right, that alternates can be prescribed by the providers, so the patient does not have a problems of buying the medicine. Look, this is how the prioritization work is so important, right? For every individuals in these healthcare workflows, either the peer caregivers, providers, patients, and administrations and everything, right? So in the absence of that, right, that the things becomes very costly and it may not be manageable at all. So the healthcare, that's the total healthcare or the service of the healthcare, that's where we talk about, right, that may not be up to the mark. So then missing items, submission risk, that's also comes. Next actions, what are the next action as to do everything is done. Now I'm able to explain that's how the different documents in the healthcare verticals is helping for the clinical workflow and prior authorization workflow. Now I will show you a chat. Now look at the conversations. I have some prior conversation I wanted to do, right? So show you that there's some about the discharge summary. There's I asked a lot of questions, right, from all these documents that is uploaded, right? I says from discharge summary, show me the details of the hospital's visits. It fantastically summarize that's what happens in the hospital. It has a lot of documents. It takes the information from different documents, not for single documents, and summarize everything. What are the medication given? What are the diagnosis given? Right? So, and all of these details. Then the discharge medications are what? Right? It is able to take follow-up instructions and everything. AI generates by its own. Right? Then I ask actually which medication is the biggest risk factor. You see, that's when I ask the which medication is the biggest risk factor. It mentions, right, that's lactulose and rifaximin are the biggest. What are their dose? It also mentions, right? What is the problem if the rifaximin that the patient does not take, right? So then it basically extract this information from different pages. Again, there's a semantic search, right? That's we I think I did discuss it with the hybrid search earlier, right? So how it extracts the information from a first. Here it looks from the agentic workflow that it runs across all the documents, and then if it's not able to assemble all the information properly, then it goes to the hybrid retrieval and get the data back, right? And so it is important to run the agentic workflow to all the documents, right? So now, what is the summary of nurse notes during hospitalization? Then it looks at only the notes that is related to the nurse, right? So what at the 23rd, whatever they gave 24th, what they gave by date also, it basically says that these are the nurse note and discharge also what is that. Then what I did is now I switched into the different language from English to Bangla. What happens is even when I ask the nurse নোটগুলোর আমাকে সারাংশ দেখান এর মানেটা this means that give me the summary of the nurse notes, right? And what happens is with these Bangla, it also returns the answers in Bangla, so it supports the multilingual. So for example, patient is not fluent in English. There's a lot of elderly people that can happen. If the patient is not fluent in English, they might be fluent in Spanish or the other languages. Currently it's supported 5 languages, so you can ask a questions in any of the languages. Even the instructions and all of these things is written in English, right? Still it will be able to get your answers from that particular language. This is how powerful it is, right? So also it can work with any documents with those that can be a different languages, right? And can extract the informations and can present informations in English. It has a features for speech as well. So that's you can talk and that can also extract the informations based on that, right? So I think I think that is I wanted to get in the Spanish. Spanish also gets returned here, right? So I think I'm able to explain our agentic AI workflow for the healthcare verticals. Thank you so much.